West Virginia lawmakers met last week to discuss the future of Certificate of Need in the Mountain State, with Governor Patrick Morrisey calling for its repeal. Good evening and welcome to 12 News at 6. I'm Eric Miner. 12 News' Jefferson Pan joins us live now in the studio to help us understand these laws and the debate surrounding them. Jefferson?
Certificate of Need, or CON for short, is the public health policy that mandates healthcare providers get government permission before they build, expand, or offer a new service. The opponents of CON say it stifles innovation and limits access, driving up costs. Proponents say it's necessary to ensuring health care throughout the state. I talked to people on both sides of this issue with this report. The Cardinal Institute is a nonprofit think tank that is calling for the repeal of CON. They say that by repealing CON, West Virginia healthcare gets open to more competition, and that will yield greater supply and lower costs for consumers. The West Virginia Hospital Association paints a different picture. They point out that a significant portion of West Virginians use government insurance like Medicare or Medicaid. They say that these government insurances frequently pay hospitals below the cost of the patient's care, and that the hospitals are buoyed by payers with private insurance. With the repeal of CON, they fear companies will focus on serving high-paying patients, drawing them away from rural hospitals, which could cause them to close.
They're going to service and really go after only that commercial pay patient, where they're going to cover their costs and actually make significant margin. Right now, that patient is in the hospitals in West Virginia, and the higher payment is actually subsidizing other services.
The Cardinal Institute argues that the decision-making for CON is too influenced by established healthcare providers rather than actual healthcare needs. They say its repeal would allow for smaller outfits to move into rural communities, increasing accessibility to care.
Removing barriers for people to come in and create smaller facilities, whether it's a physician's office or an ambulatory surgical center, is only expanding care. So a lot of these things are really just protectionism at its finest, and we want to ensure that people are able to provide care to communities that need it most.
The Cardinal Institute also points to research that they say suggests states with CON have higher healthcare costs and fewer hospitals in rural areas. NIH research that reviewed 90 articles in the literature found that on average, the articles did say CON increases costs, though they say the extent is uncertain. Senate Bill 453, which proposes the repeal of Certificate of Need, was introduced early in the session. 12 News will keep you up to date on the status of the bill as the conversation around CON progresses. Eric?